faculty there after residency and became the founder and director for the Center for Integrative Medicine. So all the integrated and holistic therapies that people enjoy that are outside the medical system, yoga, acupuncture, mindfulness meditation, nutrition, all of that, we wrapped into the Department of Integrative Medicine and brought that into the academic medical center. I was also one of the founders of the Osteopathic Medical Center and community. Someone affiliated with UCSD is just across the street right here. We osteopaths, we can refer patients to Rehab United for the past 20 years. And like Brian said, I've always had this in the back of my mind that the healthcare system is a reactionary system, very reactive to problems. So you hurt your knee, you have something going on with your heart, something going on with your kidneys, you have a reaction, you end up at the emergency room, urgent care, and then we start coming into action with where Western medicine is. With my background in holistic and integrative medicine, I was thinking that there has to be a different way of looking at healthcare. How can we turn from a reactionary system to what he used, the word that we're using a lot, proactive? How can we be proactive in this? This became an academic research project I did for several years, of being able to monitor patients proactively. How do you do that? Because we were using technology as one of the tools to do that. And right now that's getting down to different types of health monitoring devices that we monitor you on a daily basis. Just like we do if you've ever been unfortunate to ever go into the hospital or you've ever been in the ICU. There's a lot of devices, you're connected. The nurses, the doctors that are there, they're monitoring you very closely minute by minute. We want to see if we can be able to do that sort of monitoring on patients out in the real world. And so part of the academic project I had was getting a grant to do just that. And then from that sprang this idea, like we can create a clinic that's out there to be able to proactively monitor patients and do it through a system that we call proactive health monitoring. So I created this clinic, Measured Wellness, to do just that. So that's two things. One is health monitoring, so we monitor your health in a variety of different ways. We use technology to go ahead and do that, but we also do education. We educate you about your lifestyle, we educate you about your disease process, we educate you on how to use these devices, how you can use it on your health journey. So when I started talking with Brian, I'm like, Brian, you're going to have a whole subset of patients in the musculoskeletal realm, physical therapy, back pain, neck pain, knee pain. Let's see if we can create a system that we can proactively monitor these patients as they go through for Rehab United, for physical therapy. And Brian shot it back at me. He's like, wow, I think there's a bigger picture here. How can we do this not just for musculoskeletal system? Can we do this for the entire system? Body, cardiovascular, respiratory system, pathology, all that sort of stuff. Can we create a different model of healthcare where we, physicians, you as the patients, have access to information about your health on a day-to-day basis? Right now, the model of going into the doctor, if you're lucky, maybe you get to see your doctor once a year, maybe twice a year. During those visits, maybe you have 15 minutes, and if you're lucky, maybe you have 30 minutes with your doctor. It feels like a lifetime. But then you're waiting a whole other year to see that doctor again, right? If there's a specialist, maybe it takes 3 months to even get in to see the specialist. And before that, you had to wait 2 months to even get the MRI before you saw the specialist. So we want to see if we can compress all of this and get things to happen at a lot faster pace for individuals that are part of this system. And that's what we mean by being proactive. Using technology to get information about your health. We can proactively measure and do things and order different tests with you and make these referrals earlier upstream, like Brian said, as part of that system. So this is the high-level view of what we're doing, and this is the why we're doing this. We see a much bigger picture in the healthcare system of creating a model that's out there. Can we bring this to many other clinics, to many other PT clinics, to many other different practitioners that are out there? And then we'll get into the what Measured Wellness is all about, and how it's done, and we'll bring up our team in just a second. But thank you for being here and listening to us. We're going to take questions at the end, but I know it's a lot of information that you're going to learn, and there's going to be some questions about it. We've worked with insurance companies
about a security system for your health or putting a smoke alarm in your house. You hope you never have to use it, right? We don't even look at our smoke alarms most of the time. We don't check our cameras at the house and tell what happened until someone's trying to break in or there might be a fire, right? Usually be cooking and not paying attention and something goes off. Ultimately, we want to have that security system for your health. And so we use data, and data's behind the scenes. So if you're not a tech person, it's not a big deal. We don't have to do anything per se, but yet that data provided is really there to share patterns. You know, we very brief examples. We have some patients that clients that we believe this was going to be great, but now that they're in the program, one of them is driving to work and he gets a phone call from Measured Wellness. Hey, we have a concern. Your blood sugar is really, really concerning right now. Is there something that's been on? And this person happened to be running out and grabbing an instant oatmeal and literally spiked. And now realizes as they're having this conversation that, wow, my heart rate's up, I'm actually sweating, I should pull over. So that's a scenario where we've had people fall, and we can go back and look at that time frame for the fall, we find there was a cardiac issue. That's really, really important, the fact that we have this security system, we have this ability to monitor, so we're really being proactive in that care. Obviously, we said that we're about 100 times now, but it's so important in terms of realizing what the patient's value is when it comes to that, and that security system for your health is what we're really excited about. So we'll stop talking.
Yeah, the other, I mean, it's a great analogy about, home security or the smoke alarm for your health. The other analogy I use, it's just at the top of my mind, is my wife's car engine get fixed is, that check engine light that comes on, right? You see that check engine light come on, you all get a little nervous, something's going on with the car, you gotta take it in to the dealership, you take it into the mechanic. We wanted to create a system in healthcare that would turn on that check engine light and notify you. Right now, that doesn't happen. You're waiting until your arm breaks, you're waiting until you're bleeding from something, your vital signs are going way too high or way too low, and then you're coming to the doctor to complain about it. There are ways out there that we can look at and turn on that check engine light and notify you, just like you gave me an example. We get those notifications that there's something going in the wrong direction. Can we be that sort of security system behind the scenes for everybody? So that's what we're just trying to do. I was talking with the mechanic and watching how they diagnose the car, watching how when people come in and most people are taking better care of their car than they are taking care of their own body, right? And so that's what we're trying to do is create these analogies for people to understand. The technology is already out there. We're just trying to create the system to help you all get to that place. So we'll stop talking. We'll bring our team on to discuss. We talk about like why we're doing this sort of thing. We're going to talk about what it is and how it's actually done. Yeah.
Thank you guys so much for coming in. Like I said, for these nights, you're here to figure out how you can be proactive about your health, not just reacting when something happens. So again, thank you. My name is Stacey Self. I'm an integrated nutritional health coach, and I'm also the
we thought the paperwork with you, about the insurance, so
Yep.
you are the, you make it happen basically.
Correct.
You have one,
Yep. And there's no cost to fill out, and like she said, you're not signing up for anything, just we'll contact you and say, here's what your insurance covers, and if you decide to move forward. Yes. And it's protected by the law.
No, it's de-identified data, so it's always, this question always comes up, and Brian brought it up in the beginning. So, like any medical office, it's like every Rehab United, we have to go under the law, HIPAA, called Security Information Act. And that data is de-identified, and we're not allowed by law to sell it to anybody without your consent. And the data is owned by you, so you can choose. If you just want to collect your own data and you want to look at your own blood pressure and you want any of our providers to look at it, that's totally fine. You choose what to do with it.
One thing I did want to touch on that I didn't say earlier, because I know Brian was sharing where we reached out to the patient. We do have urgent alerts when things do come in, but I want to make sure we're really clear we're not an emergency service. So if your blood pressure is spiking and nobody's calling you, go to the emergency room. We're not, like, it's not on us to call you, like, if you feel something, definitely go into the emergency room. But we do use the data to help direct you, or we will reach out to you if we do see some concerning things.
Last thing, we talked a little bit about classes,
Yeah.
right? So we have, online classes that
Yeah,
you
so
can take in a variety of different subjects. We're also bringing classes in-house of balance, function, strength, stability, will be in-house that you attend, as well as the classes that are provided online.
Yeah, we got monthly classes that are released in through, so we just released October's classes, those are on the flyer with some of the remaining September classes. In October, we're going to release November's and so forth. So those are always going to be announced through your client portal, or they will have flyers here from Rehab United with any new releases that we have. All of them are online, yes. And they're all done in a group setting, but again, still in a HIPAA compliance, safe environments. A lot of our patients are thriving because they're creating nice little communities. You see the same faces, going to the same classes. A lot of them, a lot of them do that.
Are there ever, I know you mentioned that you say you saw something, you could try to contact their primary care to maybe try to get them in sooner, because I know access is the challenge, is not people see the doctors. Will there ever be like a network of doctors linked with you guys that are primary that can be under this umbrella where patients have like, just guaranteed access to anything of that kind?
We're definitely not primary care yet, but I just know we discussed branching into that area.
You're getting to the next phase of our project, probably a year after that.
Okay.
Ideally, we'd like to get there, so there's an entire network of primary care doctors and specialists that are part of all of the schemes. We have to start somewhere. But in the ideal situation, say you had an entire network of physicians that were affiliated, and then you can refer patients really quickly through that entire network. Not only for physicians, but the relationships we have with lab imaging, we can definitely compress that timeline to get those tests ordered now. The physicians we're working with, we'll get that set up as the year go on.
Generally, people are asking that because they have such great access and care, they say, well, can you just be my primary? And certainly that's in the future potentially, right? But in the interim, like, you're really trying to work closely with providers here in insurance. So a lot of times we're taking that data and saying, I don't fully understand this stuff.
So if we need to contact them directly, when you can take the data and the summary that we have that comes to monthly, and take it to them, and of course, if they get it and they're like, I don't know what to do with this, they can contact our team, and we will set up a meeting to explain things to them, or make suggestions on where and why we think that they need certain, interventions.
Okay, that's a great question. So we do the health monitoring, we do education, but we also do health reporting. The reporting goes to you as the patient. But you already might have your primary care doctor, you might have your oncologist, your cardiologist, your GI doctor, you might have a great care team. And then it's my job as a physician to take all the information that we've learned about you, put it in a form that your care team will understand. So when you go to your cardiologist, you'll get a report that reads out how your blood pressure, your pulse, whatever else, whatever the metrics that we're monitoring. It makes it easy for that physician to understand, because they only have a short window of time to see, right? They don't want to give them too much data, they don't need too much of a story. But as we've seen in healthcare, and I'm sure all of you have experienced, it's not only is it reactive, but it's segmented. And you see your primary doctor, they refer you to physical therapy here because you had a hurt knee and you need to go see the orthopedic surgeon. Well, your primary doctor, orthopedic surgeon, and physical therapist sometimes aren't even talking to each other. Right? It's up to you to go tell them, like, well, my knee's doing this, and I did this many steps, and I have pain on this side. So we're trying to help bridge those gaps and fill those holes where you're able to go to these specialists and they already know all that information about you. We've given that report. So imagine going to your physical therapist like Brian, and he's like, well, did you do your steps? Did you do your exercises? We have the data if you're doing your exercise. You can't lie to him. There's a different level of accountability.
I have a question. I always found that people would get, all the people I know that are getting wearables now are north of 50 years old, and I'd say, well, what are you doing with the data? Well, I knew I did 10,000 steps. It's like, wait, this thing does way more than just assess your steps. The big thing for healthcare is sleep is vital for healing, and what we don't have access to is data on how someone's sleeping, and
great sleep, all that, but if someone, you know, in a meeting with you guys and they're complaining about back pain, hip pain, something along those lines, are you guys able to directly refer Medicare patients to Rehab United?
Yeah, great question. It's like you brought it up, because musculoskeletal pain is the number one reason people see the doctor in the primary care world. And that could be back pain, neck pain, headache, whatever it is, but musculoskeletal pain. So we knew the musculoskeletal system was gonna be a huge part of this program, hence why this huge partnership here. But yeah, we can make direct referrals to Rehab United. And like Brian said, it's gonna be a lot more than just referring the patient. We're gonna start having live classes here in all the different Rehab United facilities. On top of, if patients can't make it, we will have physical therapy